Hi, I'm Olivia, Project Support for the Sustainability Team and a registered nurse by background. And this is Sustainable Voices at UCLH. Here we'll talk to our staff about what sustainability means to them and what inspires them to make sustainable changes for our patients now and in the future. So let's get started.
Hello, I'm Jonathan Joseph. I'm a consultant ENT surgeon working here at UCLH. I've been here now for almost 8 years as a consultant, and I'm based mainly in the Royal National ENT Hospital on Huntley Street and also in the Grafton Way building.
Great, thanks for coming. Can you tell us a little bit about your career background?
So I'm actually born and bred in Manchester, but came down to London to do my ENT specialist training. And so I've moved around various hospitals throughout London, also a little bit in Oxford and the surrounding areas. And then I came here in 2017 as a consultant for ENT. And my particular areas of interest are rhinology, so all diseases of the nose and sinuses, but also I do a lot of pediatric ENT, and I'm currently the clinical lead for pediatric ENT in our department.
What inspired you to think about sustainability in your clinical practice?
So it's well known that healthcare is a big contributor to carbon production and also waste production within the country as a whole. And within healthcare, operating theatres are one of the biggest contributors. So I started thinking about common practices that we have within operating theatres and whether there are changes that we could make. The first area that I was looking at was the use of theatre scrubs for certain procedures and whether we need to use the normal scrub gowns that we would have for any operation. So for instance, a tonsillectomy procedure, which we do very commonly within ENT, it's one of our most common operations. Some people are starting to think, is a theatre gown required for it? And certainly if we are going to use a theatre gown, should we be using a reusable one rather than a single use? So we managed to, we did a questionnaire-based survey looking at what common practice across the country and whether there is a mood for change. Do people feel that actually, just because we've been doing the same thing for many years, doesn't mean we have to doing it that way? And actually quite a lot of people felt that going forward, theatre gowns for certain procedures are not required, and that was all the waste and things like that. So that got me thinking about other sustainable things that we can do and moving on from there.
In your view, how can sustainable healthcare practices benefit both the environment and patient care?
So we have to think about lots of things that we do within our common practice in terms of treating patients and sometimes questioning these practices and deciding whether we can change things. And often when we're looking for efficiencies, that will often go along with a more sustainable approach to how we treat patients. So an example that I've started to really focus on is moving patients from a traditional operating theatre setting to an awake ambulatory setting. So here at UCLH, we're very lucky that in the ENT hospital, we have the procedure zone used by both the dental and ENT teams for doing awake surgery. So we're avoiding everything that goes along with a general anaesthetic. So fewer hospital appointments, so no pre-assessment, for instance, a much shorter stay in hospital, avoiding the volatile gases and everything that goes with the anaesthetic. And it's a much faster, smoother pathway for the patients to have their procedure. And we can also show now with the data that we have that it still produces good outcomes for the patients. Because of course we have to still do a good job and we have to maintain safety. So it's thinking in that frame of mind for how we can change what we do in a way to maintain quality and safety to work in a more efficient and more sustainable way.
Yeah, it's a fantastic example of sustainable healthcare benefiting both the environment, but also upholding good quality patient care. Next question is, what do you see as the future of sustainable healthcare, and how do you envision your role evolving with it?
People are becoming more aware of the problem. Some would call it the environmental emergency and global warming and the contribution of carbon and waste and all these things. So it's something that we all need to think more about. And many of us are very good at doing it at home, recycling, turning off lights and things like that. But we don't always think about it so much at work. So we need to change our mindset and think about how we can change our practices in a safe way so that we can become more sustainable. So thinking about moving more to reusable rather than single-use gowns, instruments, all sorts of things. Our prescribing practices need to think about how much medicine for whatever it is do we actually need rather than just prescribing a bit more just to be on the safe side. Turning off lights, it sounds simple, but actually it can lead to huge savings both financially and from a carbon footprint point of view. And it's just try to think a little bit outside the box. Don't do things just because that's the way they've always been done. We now have different insights and different priorities, and I think that's the way to really make a difference for the future.
How do you think the healthcare sector can encourage more clinicians to develop sustainable practices?
So here at UCLH, we're very lucky that we do have a sustainability program. We have many people working to help promote sustainable solutions, and we need to promote that culture more widely. So we have a number of initiatives already ongoing. So for instance, there's the Gloves Off campaign, asking people to think about whether they need to use single-use gloves or not. But also there is the environment whereby if someone has an idea for how to make a sustainable change, then there's the infrastructure and also the culture to allow it so that people can then go on to make the change that they need. So we need to really push that more widely, and at UCLH we can promote what we do and show examples of changes that could be made for the future, both in our trust and more widely. So if we can really push that in any forum that we can, and also involving, as I've seen, some of the Royal Colleges. So the Royal College of Surgeons has a strong program of sustainability, and I've attended one of their days recently to talk about various things that we can do so we can get wider engagement, and that can lead to better adoption of sustainable practices.
Yeah, really great examples. And the last question, what opportunities are there in UCLH for clinicians to get more involved in sustainability?
So as I was mentioning, there are current programs that we're working on. So the Gloves Off campaign, and then there are various things going on in the background. So we're looking at ways so that we can turn off lights, turn off ventilation systems in operating theatres, so people can get involved in understanding how we can make that happen. There is a move now to reduce nitrous oxide in the trust. So it's sort of making sure that the people who will be affected by that know how to change their practice, know what impact that will have on patient care. And apart from that, it's promoting that culture whereby if you have a good idea, come and let us know. We can help you make it happen for you when needed.
And I would add, we also have our sustainability network, and you can also become a sustainability lead. We also now just launched a climate awareness e-module on my UCLH Learning Hub. So you can check out and understand a little bit more about sustainability there. All right. Thank you for coming along.
Thank you.